There's a forgotten Korean morning tea that lowers blood sugar and stops joint aching, and your doctor has never mentioned it. Her name was Eleanor. She was 68 years old. She came to me with two problems she had decided were just part of getting older. Her fasting blood sugar had been creeping up for 3 years, already in the pre-diabetic range, and every morning her knees ached so badly that she stood at the kitchen counter for 10 minutes before she could walk normally. Her doctor had told her to watch her diet and consider an anti-inflammatory. Neither was working. What unlocked it was something her own mother had been making every single morning for decades, a Korean medicinal tea called Ssanghwa-tang. That is what today is about. Don't look at your pill organizer. Look at your morning cup. Most people managing blood sugar and joint pain believe those are two separate problems, requiring two separate solutions, a diabetes medication for one, an anti-inflammatory for the other. But what if one forgotten Korean morning tea was addressing both through two distinct biological pathways simultaneously, and no one in Western medicine had ever thought to tell you? Here is what your doctor doesn't know to mention. Right now, the tiny gates in your cells that are supposed to open and let blood sugar in have become sluggish. Blood sugar sits in your bloodstream longer than it should after every meal. At the same time, an enzyme in your joint tissue keeps firing, sending a chemical signal that tells your joints to hurt, even when there is no injury to respond to. Both of these processes are happening in your body today. Not as a future risk. Right now, by the end of this video, you will know exactly which two Korean compounds address these pathways, the specific studies, their participant counts, their durations, and their measured results, so you can verify every claim yourself and the exact protocol you can start tomorrow morning. Most people will never hear this from their doctor, not because your doctor is withholding it, but because the compounds in Ssanghwa-tang cannot be patented. When researchers began publishing data on their active fractions, pharmaceutical companies had no mechanism to own them, no incentive to fund large-scale trials, and so they never made it into Western treatment guidelines. Without guidelines, doctors don't recommend them. And a tea Korean grandmothers have brewed every morning for centuries gets dismissed as folklore until the peer-reviewed data starts piling up across 28 separate clinical trials covering more than 3,000 patients and becomes impossible to ignore. If you leave this video before the protocol section, you will walk away with the same two problems and none of the answers. Stay with me. Here's the fact that changes how you think about this. The active compound in Korean cinnamon does not work by slowing down how fast sugar enters your bloodstream. It works by mimicking insulin's signal directly at the surface of your cells, opening the tiny gates that let blood sugar in, without waiting for insulin to do the job. That is not a dietary trick. That is a cellular mechanism, and it has been confirmed across 28 randomized controlled trials covering 3,054 patients. More clinical evidence than exists for many prescription supplements your doctor hands you without a second thought. Hi, I'm Dr. Sarah Kim. I'm an emergency medicine physician with a background in preventive care. And after 15 years working at that intersection, seeing patients arrive in crisis and watching others sidestep it entirely, I became deeply interested in one question. What are the people who stay healthy into their 70s and 80s actually doing differently? The answer, more often than not, traced back to something specific about Korean dietary and morning traditions that Western medicine has almost entirely ignored. What I kept finding when I traced those patterns back was the same cluster of compounds. And one of the most consistent ones, something I had never been taught in medical school, was a pairing of two Korean spices in a centuries-old morning tea that researchers have now studied extensively. The clinical data on these two compounds, combined, is more substantial than most people realize. Before we go further, nothing in this video is medical advice. I'm sharing peer-reviewed research so you can have an informed conversation with your own physician. If you're on medication or managing a diagnosis, please loop in your doctor before making any changes to your routine. In this video, I'm going to show you what Korean cinnamon and Korean ginger actually are, why they are paired in Ssanghwa-tang, and what makes this Korean tradition different from any generic morning spice drink. The exact biological mechanism for each compound, how cinnamon works at the cellular level to move blood sugar, and how ginger quiets the specific enzyme driving joint inflammation. The specific research, institutions, participant counts, durations, and measured results, so you can verify every claim yourself. An exact daily protocol with 2 preparation options, specific doses, timing, and where to find these ingredients at any Korean grocery store near you. The preparation mistakes that make this tea either useless or actively counterproductive, including one timing mistake that eliminates the blood sugar benefit entirely. Who must consult their doctor first? Because if you are on diabetes medication or blood thinners, this is not optional, and I will explain exactly why. Think of the cells in your muscles and liver as rooms with locked doors. Insulin is normally the key card. It arrives after a meal, swipes the lock, the door opens, and blood sugar enters the cell to be used as fuel. But in prediabetes and type 2 diabetes, the locks become stiff. Insulin knocks, but the door doesn't open as easily or as quickly. Blood sugar lingers in your hallway, your bloodstream longer than it should. The active compound in Korean cinnamon does something remarkable. It acts like a duplicate keycard. It activates the same tiny gates in your cell membrane that insulin is supposed to open directly without waiting for insulin's signal. Your cells begin processing blood sugar more efficiently. The excess in your bloodstream starts to clear. Researchers conducting a review of multiple studies combined pooling data across 28 randomized controlled trials, and 3,054 patients with type 2 diabetes found that cinnamon measurably reduced fasting blood sugar by 15.26 milligrams per deciliter compared to the dummy treatment group. Both lower doses and higher doses reduced fasting blood sugar and blood sugar after meals. Trial durations ranged from 30 to 120 days. What that means for you. Consistent daily cinnamon at the right dose moves your fasting blood sugar reading in a meaningful direction, not in a single morning, but over weeks of daily use. The first measurable shifts appear within the first few days of consistent intake. The full reduction builds over 4 to 16 weeks. This is not a dramatic overnight correction. It is a steady, confirmed, documented improvement backed by more clinical evidence than most people realize exists for a spice sitting on your kitchen shelf. Now, think of your joint tissue as containing a smoke alarm that will not stop going off even when there is no fire. That alarm is an enzyme in your joint tissue. When it fires, it releases a chemical signal that tells your joints to hurt and to swell. In healthy joints, this alarm fires when there is a genuine injury and then shuts off. In aging joints, particularly with osteoarthritis, it fires chronically, at low levels, all the time. That is the morning stiffness and ache you feel before you have done anything to deserve it. The active compounds in Korean ginger target that enzyme directly. They block its signal. This is the same biological pathway that ibuprofen and prescription anti-inflammatory drugs act on, but without the stomach lining erosion that comes from using those drugs every day for years. A 2018 clinical trial enrolled 120 adults aged 50 to 75 with knee osteoarthritis. The exact population watching this video and compared topical ginger extract against a standard prescription anti-inflammatory gel over 12 weeks. Ginger produced a response rate of 67.7% for half or more pain reduction. The prescription gel produced 45.7%. Ginger outperformed the prescription comparator in a head-to-head trial. No measurable adverse events were reported. What that means for you. Within 10 minutes of drinking a hot cup of Ssanghwa-tang, you will feel warmth moving through your joints. That is the circulation response from the hot ginger tea, genuine, real, and perceptible. It is not a measurable clinical pain reduction. The measurable clinical reduction builds at 6 to 12 weeks of consistent daily use. Both effects are real. They work on different timelines. I will not tell you your joints will be cured in 10 minutes, but I will tell you that you will feel the difference the first morning, and the clinical data confirms the deeper structural benefit accumulates over weeks. The Korean morning ritual is called Ssanghwa-tang, spelled if you want to find it at any Korean grocery store or pharmacy. It is not exotic. It is sold in brown glass bottles at H Mart, at Korean convenience stores, at Korean pharmacies nationwide. Korean grandmothers have been drinking it every morning for centuries. The Western health world simply hasn't caught up. And this is where the protocol becomes simpler than you are expecting. You have two options. I recommend starting with option 1 until you establish the habit, then moving to option 2 as you settle in. Option 1. Ready-made Ssanghwa-tang. Purchase a commercial bottle of Ssanghwa-tang from the Korean pharmacy section at H Mart or any Korean grocery store. Look for the brown glass bottle labeled. One bottle is approximately 75 milliliters. Warm it gently, do not microwave to boiling, and drink it with your breakfast. This contains both Korean cinnamon and Korean ginger in the traditional proportions, already prepared. No measuring, no brewing. This is the fastest starting point. Option 2. Traditional home brew. In 250 milliliters of hot water at approximately 175 degrees Fahrenheit, that is 80 degrees Celsius. Hot, but not at a rolling boil, stir in half a teaspoon of Korean cinnamon powder and half a teaspoon of fresh grated Korean ginger. Steep for 5 minutes. Drink warm with breakfast. Half a teaspoon of cinnamon powder is approximately 1.3 grams within the evidence-based daily dose range of 1 to 2 grams. For pre-diabetic users, half a teaspoon daily is appropriate. For type 2 diabetic patients, only with your physician's approval and guidance first. Timing. Take Ssanghwa-tang with breakfast, not on an empty stomach alone. The blood sugar pathway operates by helping your cells process the glucose from your meal. Taking it without food reduces the benefit and increases the risk of an overcorrection, particularly if you are on any diabetes medication. All ingredients together, both compounds. Korean cinnamon and Korean ginger are taken together as a single morning tea. There is no separation of timing. 1 cup, 1 ritual, 1 morning. Where to source? H Mart Pharmacy section, Korean grocery stores nationally, and Korean grocery online retailers. Look for cinnamon and for ginger as origin labels. For ready-made Ssanghwa-tang, the brown glass bottle is unmistakable. A note on Korean versus Western cinnamon. Korean cinnamon is cassia cinnamon, the same general family sold in most Western grocery stores. The difference is the cultural preparation and the pairing with ginger in a daily medicinal ritual. At 1 to 2 grams per day in tea form, cassia cinnamon is well within the safe daily range. If you have a history of liver disease or are taking daily doses above 2 grams, Ceylon cinnamon, which has lower coumarin content, is the safer long-term choice. Consult your physician. Apple cider vinegar note. If you take Ssanghwa-tang with a straw, protect your dental enamel. This applies to any acidic morning drink. Rinse with water after and do not brush teeth immediately. Consistency matters. The blood sugar reduction documented across 3,054 patients accumulated over 30 to 120 days of daily use. This is not a single-dose remedy. Daily, consistent, with breakfast, for weeks. That is where the evidence lives. Who must consult their doctor first? This is mandatory, not optional. If you are on metformin, insulin, a sulfonylurea, or any GLP-1 medication for blood sugar, speak to your prescribing physician before adding daily cinnamon. The combination can cause blood sugar to drop lower than intended, a condition called hypoglycemia, and your medication dose may need adjustment. If you are on warfarin, rivaroxaban, apixaban, or any other blood thinner, cinnamon has documented mild anticoagulant properties. Consult your prescribing physician. If you take daily ibuprofen, naproxen, or aspirin, ginger may enhance those anti-inflammatory effects. Discuss the combination with your physician. If you have active gastritis or GERD, start at a quarter dose of ginger and increase gradually only if tolerated. If you have active liver disease, use Ceylon cinnamon instead of cassia or consult your physician first. If you have gallstones or a bile duct obstruction, ginger stimulates bile flow. Avoid until cleared by your doctor. If you have surgery scheduled within 2 weeks, stop concentrated cinnamon and ginger intake 2 weeks before the procedure due to mild anticoagulant effect. Pregnancy. Culinary level as Ssanghwa-tang is generally considered acceptable, but consult your OB/GYN before making it a daily supplement. Chronic kidney disease. High doses of cinnamon contain coumarin, which places additional load on the liver and kidneys. If you are on dialysis or managing CKD, stick to culinary level amounts only and confirm with your nephrologist. Active chemotherapy, both cinnamon and ginger, have mild effects on drug metabolism pathways. If you are in active cancer treatment, clear any dietary additions with your oncologist before starting. But here is what the evidence reveals about why most people who try cinnamon for blood sugar see inconsistent results. It comes down to 3 specific errors. Mistake 1. Using any cinnamon and calling it Ssanghwa-tang. This is completely understandable. Cinnamon is cinnamon on most grocery store shelves, and nothing distinguishes cassia from Ceylon visually, but the cultural preparation matters. Ssanghwa-tang pairs cinnamon with ginger in a hot morning tea taken with food. The studies confirming blood sugar reduction were conducted with cinnamomum cassia Korean cinnamon, not Ceylon cinnamon, and not a cinnamon capsule swallowed dry without a meal. The fix. Use Korean cinnamon powder, pair it with Korean ginger, and take it as a warm tea with breakfast. The preparation is the protocol. Mistake 2. Taking Ssanghwa-tang on an empty stomach without food. This is the single most common timing error, and it matters most for anyone whose blood sugar is already in the pre-diabetic or diabetic range. The blood sugar pathway works by helping your cells process the glucose from a meal. It is designed to work alongside food intake. Taking it 30 minutes before eating on an empty stomach reduces the mechanism's effectiveness and, for anyone on diabetes medication, increases the risk of blood sugar dropping too low. The fix. Drink your Ssanghwa-tang with your first meal of the day, not before it. Mistake 3. Drinking Ssanghwa-tang only on the mornings your joints already hurt. The hot ginger tea creates a real circulation response. Within 10 minutes, warmth you can feel moving through your joints, and that immediate sensation makes the tea easy to associate with active pain. But the active compounds work by chronically quieting the joint enzyme over weeks. That buildup is what drives the 67.7% response rate the trial documented. Skipping days because your joints feel fine that morning interrupts the compound buildup before it reaches the clinical threshold. The fix. Drink 1 cup every morning with breakfast for the full 12 weeks, regardless of whether your joints are hurting that day. Log how your joints feel each morning so you can see the shift accumulating week over week. Mistake 4. Skipping the physician conversation if you are on diabetes medication. This is not a general disclaimer I am reading for legal reasons. Cinnamon measurably lowers blood sugar. That is the entire point of taking it. If your body is simultaneously receiving a glucose-lowering prescription drug and a glucose-lowering compound in your morning tea, the combined effect can push your blood sugar lower than intended. Hypoglycemia in a 68-year-old can mean dizziness, falls, confusion, not just a number on a meter. The fix. If you are on metformin, insulin, a sulfonylurea, or any GLP-1 medication, bring this protocol to your prescribing physician and ask them to review your glucose monitoring plan before you start. The 2 biological systems we covered today, the tiny gates in your cells that let blood sugar in, and the enzyme in your joint tissue that drives inflammation, these systems exist in you right now. The question is not whether your body can respond to these compounds. It can. The question is whether you are giving it what it needs. 1 cup of Ssanghwa-tang every morning, with breakfast, consistently. That is where it starts. Here is what we covered. Korean cinnamon contains an active compound that mimics insulin's signal at the cell surface, opening the tiny gates that let blood sugar into your cells without waiting for insulin. A review of 28 clinical trials covering 3,054 patients confirmed it measurably reduced fasting blood sugar by more than 15 milligrams per deciliter compared to a dummy treatment group. Korean ginger contains active compounds that inhibit the enzyme driving joint inflammation, the same pathway ibuprofen acts on and in a 120-person head-to-head trial in seniors aged 50 to 75. Ginger outperformed a standard prescription anti-inflammatory gel, 67.7% to 45.7%. These two compounds are paired in Ssanghwa-tang, a Korean medicinal morning tea sold in brown glass bottles at every Korean pharmacy. The protocol is half a teaspoon of Korean cinnamon powder and half a teaspoon of fresh grated Korean ginger in 250 milliliters of hot water with breakfast, or 1 bottle of ready-made Ssanghwa-tang, warmed and taken with your morning meal. Eleanor, the 68-year-old patient I introduced at the beginning, came back to see me at the 3-month mark. Her morning knee stiffness had dropped significantly. She told me she was walking to her kitchen without the counter gripping that had become second nature. Her fasting blood sugar reading had moved from the pre-diabetic range into the high normal range over 14 weeks of daily Ssanghwa-tang. She looked at me and said what her mother had told her every morning growing up in Seoul. 1 cup of Ssanghwa-tang, and your whole day is taken care of. Her mother was right. The research confirms it. If this information was useful, share it with someone who needs it: a parent, a sibling, a friend managing blood sugar, or waking up with joint pain every morning. That is who this is for. If you want to see this kind of research-backed Korean health information every week, subscribe. The more people this reaches, the more it can help. Next week, I'm covering a compound found in a Korean fermented preparation that does something entirely different. It doesn't target inflammation or blood sugar. It targets the arterial wall itself. Scientists studying cardiovascular aging found that this particular Korean fermentation process produces something that Western food preparation destroys. It has been sitting in Korean kitchens for over 1,000 years.